During the pandemic and the lockdown, I remember tons of questions from journalists saying, why are orderlies still moving between facilities? It was ongoing. There was a crackdown, but there seemed to be exceptions because we had a lack of orderlies. Why now? You say that this is the most important element of your plan. So obviously you're acknowledging that what happened during the first wave was unacceptable.
Well, we said that clearly, that mobility was not acceptable. The issue was when managers, if they, and again, I'll stress my point, if the managers didn't have the resources and had to choose between rupture of service or giving a service with taking a risk, some of them took taking the risk as a choice. So what we're saying right now, you cannot do that anymore. And if you cannot do that anymore, well, we make sure that over the next 6 weeks, you'll find solution and discuss those solutions with us. So that's the reason we gave this deadline, that is September 30th, because not all the CHSLD or not all the establishments have the same issue with personnel. So some in certain regions have different issues. So that's the reason we're saying mobility is not acceptable, and you have until September 30th to give us your way of doing it.
You're giving yourself the timeline of September 30th, but what qualifies as a second wave? On September 30th, are you going to declare if the second wave has arrived or not? How will we know if we're actually in a second wave?
Okay, that's a good question. But I think Dr. Arruda can tell you, but I would like to say something before that. Our goal is really to control what's happening right now, because the virus is here. You know, we had over the last few days 6 deaths. We still have patients that are in intensive care, 27 of them. So the virus is here. So what I think we are is somewhere between the first and the second wave, but we're controlling it right now, to the good work of Santé Publique, to the good work of people doing prevention in the hospital. So we're somewhere between that. I think what we need to be aware is the phases that could happen. As an example, in hospitals. Right now, we are seeing in the first part, so we'll have, again, as we had before, hospital that can take patients of COVID. But if that phase increase, or if the number of patients is increasing, then we can have another way of dealing, adding number of rooms in hospitals. So I don't know if that can be completed, but we are monitoring the level of cases every day, as you see. Fortunately, we're doing all right now, but we are watching that very closely, very closely.
Okay, in fact, the minister answered very well to the question, and we know also that there is, those viruses seems to have seasonality, that, you know, like each fall, winter, there is influenza, there is other viruses, and that could come back. So it's why we never have to stop, we never have to think it's a way, because it's the first, when you don't do what you're supposed to do, you can see that reemergence and the stress on the healthcare.
We don't want to see that. We don't want to see that.